Welcome to Heart Attack Awareness. If you're watching this, chances are you or someone you love is dealing with high blood pressure, one of the most common, dangerous, and yet completely manageable conditions linked to heart attacks. But before we dive in, if you haven't already, hit that subscribe button. We post powerful, life-saving heart health content every week, and your support helps us spread the message to more people who need it. Today's topic is one of the most exciting in the natural health space. A natural supplement that lowers blood pressure, not in theory, but backed by science. And the best part? No side effects. No fatigue, no dizziness, no dry cough. Just measurable, sustainable improvements in your cardiovascular health. So what is it? We're talking about magnesium, an essential mineral that most people are unknowingly deficient in. Magnesium plays a role in over 300 enzymatic processes in the human body, and when it comes to heart health, it's a game changer. Let's start with the basics. High blood pressure or hypertension is often called the silent killer because it rarely shows symptoms until it's too late. It increases your risk of heart attack, stroke, kidney failure, and even cognitive decline. According to the World Health Organization, more than 1.28 billion adults worldwide have hypertension, and only about 1 in 5 have it under control. The first line of defense for most people is medication. And while medications can be effective, they often come with side effects like dizziness, frequent urination, fatigue, depression, or worse, and many require lifelong use. This is where magnesium comes in as a powerful, natural solution that supports the body's own regulatory systems. Magnesium helps regulate blood pressure in several ways. First, it acts as a natural calcium channel blocker. In simple terms, calcium causes blood vessels to contract and narrow, raising pressure. Magnesium does the opposite. It relaxes blood vessel walls, allowing blood to flow more freely and reducing resistance. This vasodilation effect can help lower both systolic and diastolic blood pressure. Second, magnesium supports the production of nitric oxide, a compound that further relaxes blood vessels and improves circulation. If you've watched our other videos, you know that nitric oxide is a crucial molecule for heart health, and magnesium is one of its strongest supporters. Third, magnesium helps balance electrolytes, especially sodium and potassium. When your magnesium levels are low, your kidneys retain more sodium, and your body becomes more sensitive to the effects of salt, leading to higher blood pressure. But when magnesium is adequate, your body handles sodium more efficiently and maintains proper fluid balance. Multiple clinical trials have backed this up. A 2017 meta-analysis published in the journal Hypertension reviewed 34 randomized, placebo-controlled studies and found that magnesium supplementation led to significant reductions in both systolic and diastolic blood pressure, particularly in people who already had hypertension or magnesium deficiency. Another study published in American Journal of Clinical Nutrition showed that participants who consumed more magnesium had lower levels of inflammation, better arterial function, and lower risk of cardiovascular disease overall. These are not small benefits, they're life-altering. The problem is, most people aren't getting enough magnesium. The recommended daily intake is around 320 milligrams for women and 420 milligrams for men, but surveys show that up to 75% of people fall short, mostly due to modern diets full of processed food, sugar, alcohol, and caffeine, all of which deplete magnesium stores. So where can you get magnesium naturally? The best food sources include leafy greens like spinach, kale, and Swiss chard, pumpkin seeds, almonds, and cashews, avocados, bananas, and black beans, whole grains like brown rice and quinoa, dark chocolate. Yes, you read that right. Aim for 70% cocoa or more. But even with a healthy diet, it's often difficult to get therapeutic levels of magnesium from food alone. That's where supplements come in, but not all magnesium supplements are created equal. There are several forms of magnesium on the market, and each has different absorption rates and effects. For blood pressure and heart health, The most bioavailable and effective forms include magnesium glycinate, gentle on the stomach, calming effect, great for stress and sleep. Magnesium citrate, easily absorbed, may have a mild laxative effect. Magnesium taurate specifically supports the cardiovascular system. Magnesium malate, good for energy and muscle support. Avoid magnesium oxide, which is cheap but poorly absorbed. Most of it passes through your body and used. For most adults, a daily dose of 300 to 400 milligrams of elemental magnesium is considered safe and effective. It's best taken with meals and in divided doses if you're taking a larger amount. Some people may experience mild digestive upset if they take too much at once, especially with magnesium citrate, but this is rare when dosing properly. Now let's talk about safety. Magnesium is generally well tolerated. However, people with kidney disease should consult a doctor before supplementing, as impaired kidney function can affect magnesium excretion. If you're on blood pressure medications, talk to your healthcare provider. Magnesium can enhance their effects and might reduce the need for high doses. Beyond blood pressure, magnesium has additional heart protective benefits. It helps maintain normal heart rhythm, especially in people prone to arrhythmias. It supports the production of ATP, your cell's main energy source, which is vital for heart muscle function. And it helps regulate inflammation, which we now know plays a key role in heart attacks. Let's hear a quick success story. Michael, a 59-year-old accountant from Atlanta, had struggled with borderline high blood pressure for years. His doctor recommended lifestyle changes, but the numbers wouldn't budge. After watching a video like this, he began taking 300 milligrams of magnesium glycinate daily, added more leafy greens to his meals, and cut back on processed snacks. Within 3 months, his blood pressure dropped from 145/90 to 126/78. No medications, no side effects, just consistency. So what's the bottom line? If you're managing high blood pressure, magnesium may be the missing link. It's affordable, easy to find, and supports your entire cardiovascular system. Whether through food, supplements, or both, getting enough magnesium is one of the smartest things you can do for your heart. But remember, no supplement works in isolation. The best outcomes happen when you combine magnesium with other healthy habits. Regular movement, reducing sodium, managing stress, getting good sleep, and cutting back on processed foods. Here's your simple action plan. Add more magnesium-rich foods to your diet daily. Try a spinach salad, a banana smoothie, or roasted pumpkin seeds as a snack. Start with a magnesium supplement. Magnesium glycinate or taurate are great places to start. Look for a dose of around 300 to 400 milligrams of elemental magnesium. Track your progress. Keep a blood pressure log over the next 30 days. Pair it with lifestyle upgrades, walk daily, reduce sugar and processed food, and focus on sleep quality. Talk to your doctor, especially if you're on medications or managing other conditions. Let's wrap up with a reminder. Heart attacks don't have to be inevitable. With knowledge and action, you can prevent them naturally, powerfully, and safely. This has been Heart Attack Awareness. If you found this video helpful, please give it a thumbs up, share it with a friend, and don't forget to subscribe. We're building a community that's rewriting the story of heart disease, one habit, one choice, and one supplement at a time.